Generally, I used to use in cases where there is a absence of menses, suppressed menses, specifically in young girls generally, or young generation, without reason. It is not like that there should be a pathology, but suppression of menses is very important. The female never get menses for 2 months, 3 months. She feels that every time menses would appear, but it never happens to be. But the feeling is always there, and that remedy is a common remedy from the cotton plant, that is the Gossypium. So this remedy we have to learn, and we can use it in potency. Boric has mentioned that it should be used in tincture, but I have never used this remedy in tincture, but generally I used to use it in potency. So let us learn Gossypium from the Boric's Remedica. You can understand better perspective. The 2 days back we have prescribed that, and that's why we will have this session today. What Boric says, a powerful immunogogue, that means it is a stimulant for menses used in physiological doses. Homeopathically, it corresponds to many reflex conditions depending on disturbed uterine function and pregnancy. So remedy is very clearly here defined, has action on female sexual system, specifically on uterus and pregnancy. Gossypium will relieve tardy menses, especially with sensation that the flow is about to start and it does not do so. So tardy menses means which have been extended, late, delayed. Tall, bloodless patients with nervous chills. So these patients, you can find it out, the bloodless patients means anemic patients, they are looking tall with nervous chill. Head symptoms, pain in cervical region with tendency for head to draw backward with nervousness. So head feels as if it has been pulled backward by someone. Their stomach, nausea with inclination to vomit before breakfast. Anorexia, that is loss of appetite with uneasy feeling at the scrobiculum at the time of menses. Scrobiculum means pit of stomach. Female, labia are swollen and itchy. Intermittent pains in the ovaries, retained placenta. Tumors of the breast with swelling of axillary glands. Morning sickness with sensitive uterine region. Suppressed menstruation. So very important feature is that suppressed menses. Then this is also retained placenta. We have learned just now the sabina for retained placenta. This is one more remedy. Second important thing, what he mentions over there, the tumors of the breast with axillary gland swelling. Menses too watery, backache and weight, as well as dragging in the pelvis. So menses associated with dragging in pelvis, with severe dysmenorrhea, uterine subinvolution and fibroid. So it contains many pathologies related with the Gossypium, the uterine subinvolution, uterine fibroid, gastric pain and debility. So all those features, but basic theme in Gossypium is the retarded menses. Generally, if the female comes to you with certain diagnosis like polycystic ovarian disease or sometimes cystic ovaries and delayed menses, a long history of that, very long suppressed menses, this remedy is very useful remedy in order to bring back the flow. But my suggestion is that if there is a diagnosis like polycystic ovarian disease or cystic ovaries, etc., you have to find it out a constitutional remedy, and as a menstrual stimulator, Gossypium acts in that cases. Relationship, compare action similar to ergot when made from fresh green fruit, Lilium tigrinum, Simicifuga and Sabina. Lilium tig and Simicifuga, Lilium tig for the fibroid uterus, Simicifuga for the dysmenorrhea, Sabina for retained placenta. The dose mentioned by Boric is tincture to 6th attenuation, but generally what I consider is the 30 or 200 is very useful in such types of patients. So this remedy one should utilize in their practice and find it out the results with the Gossypium. Thank you very much. We'll meet again with some other remedy.